I saw a patient the other day who was suffering from obesity and was very reluctant to go on PAP therapy because in their mind, the bariatric surgery that they had been planning was what they believe would take care of their sleep disordered breathing. And this is a very common perspective amongst certain obese patients where the focus is simply, well, we'll treat the obesity with this drastic measure, which sometimes works and is sometimes very good for a lot of people. But what they're missing out on, in my opinion, is that there are risks to being overweight in relationship to getting surgery. And these risks are the actual surgical risk of having to deal with a large mass of tissues in certain cases, and also anesthesiological risk, the ability to be put to sleep in a healthy way, be intubated correctly to actually protect the airway. And it's been well described already in the literature that such individuals have their own set of risks that are higher than someone who is not obese in trying to undergo any type of surgery. So our perspective is that when someone wants to undergo bariatric surgery, we would like them to be on PAP therapy several months before the surgery so they've gotten used to it, they know how to use it. That in itself could potentially reduce some surgical risk because the treatment of PAP therapy will decrease inflammation in the airway, which is, of course, a good thing. It's also conceivable, and we've seen this, some patients actually begin to lose some weight when using the PAP therapy. And that, again, is another thing that reduces surgical risk. Then after the surgery, the person has a ready means to go back on PAP therapy because you don't lose all the weight right away. It takes several weeks, months, or years to progressively lose weight. Well, all during that time, the individual is still suffering from sleep apnea. And so by using PAP therapy directly afterwards, they continue to give themselves an optimal sleep, optimal energy, and all of these things we think will help them in the long course of trying to overcome obesity. So our model for bariatric surgery cases is get on CPAP beforehand, use it at least for a few months, and then after the surgery, continue using it, and then reevaluate, of course, once a large proportion of weight has been lost to see what the status of the sleep apnea is.